here. Doc's going to tell us some good jokes here. Welcome back. Have you been told that you need joint replacement?
Yeah, this surgery isn't necessarily inevitable.
No.
Today we have another option from Dr. Kurt Drager of Integrated Pain Solutions. And one thing we've never talked about is his stand-up comedy routine.
Yes, holy cow. You
in
could
the
be
commercial break.
in one of my shows, I'm thinking.
Well, in addition to all the jokes, you do offer a really unique laser surgery. How does this address the problem of joints and possible joint replacement?
Well, we do high-intensity laser, which is therapeutic. It'll heal any tissue that's still alive. So a lot of people we have who need joint replacements or are told they need joint replacements, but all I need to see is the X-ray or the MRI, and then if I have just a sliver of cartilage left, then usually we can help them.
Wow.
Really? Because I was told I had both knees replaced.
Yes.
Said I had bone on bone, and I had that done. I would have done anything to save those knees. But even if there's a sliver, you can work with it?
Yes, and that's why you got to see it. You got to touch it, feel it, see if it really moves in there. Once I can see that, I know usually if I can help them for sure. Wow. And so a lot of people are told it's bone on bone. Mm-hmm. So I had a lady who came in and was told she needed a hip replacement. And her name was Kathy, and I was going to bring her on today and let her tell her story because it's very interesting. She's in her 60s, and we worked on her because I saw that sliver of cartilage left, and she got great results. I mean, and not only could she start doing things, I mean, she lost a ton of weight. She could garden again. She can play with her grandkids. That's what in fact, she's gone this week on vacation with her grandkids, that's what really makes it, you know, on fire to be able to do this because they get their life back. But what was interesting, I asked if she would come on, and she said, well, I can't. I said, well, why not? I said, you got a great story. She said, well, because I'm in the witness protection program, and if I go on there, I'm finished, she said. And, you know, and I'm like, oh, well, then we won't do that.
They don't stop. They don't stop.
But seriously, she told me that. And she had me going. But she lied to me. She was just nervous about coming on, so, you know.
Dr. Drager, what is the benefit of keeping your own equipment, so to speak, keeping your own joints, especially for those younger patients?
Yeah.
They don't, you know, if you get a joint replacement or a hip replacement, whatever, they don't usually last forever. I mean, if you live 15, 20 years, chances are you'll need another one. But the other side effects is, and I've treated this after the replacements, is infection. Infection will just ravage the tissue around it, and then they might have to have a second replacement, or you get tons of scar tissue. And even if you get a good replacement, chances are you'll have some scar tissue from that joint replacement. So it's never quite as good, and you never do as much as if you get to keep your original equipment. And if I can get a joint moving, like in a three-dimensional way, that joint capsule will produce fluid, which is 100 times more slippery than Teflon. And that's just enough. If you get a higher amount of fluid in there, that'll keep that joint alive for many years.
Wow, I tell you what, I wish I would have known you 6 years ago. Anyway, so it's major surgery. I've had it. It's that joint replacement is major surgery. And
usually you can tell. If somebody needs it, I'll tell them.
Okay.
You need it. You got to get a new wheel.
Okay.
You know, I'll tell them right up front because it doesn't pay. Because if I know I can't help somebody, I'll tell them.
Yeah.
And how is your laser therapy so unique?
It goes deeper. In order for the laser to work, you have to go down this deep to touch the cells. Most lasers go down 1/4 inch deep. That's not enough. You know, I mean, the Packers have a great 30-watt unit. Ours are 60 watts. So half the guys come down to see me because I can go deeper.
Wow.
I mean, it's not like they're not thick guys, you know? So you have to get deep enough, and you have to have enough power to get a bigger spot. So you have to cover all the tissue that's damaged. And when you can do that, your results are through the roof.
Yeah.
Well, you can get that assessment and some of his great jokes by getting in touch with Dr. Drager and Integrated Pain Solutions. They're located at 827 Cormier Road in Green Bay. His website is painsilver.com. Toll free 844-200-7246. Schedule your no-cost consultation today. Thanks so much, Dr. Drager.
Thanks for the laughs.
Thank you.